Hi, I'm Mike Lecouture, and this is the West Block, politics, perspectives, and players.
Hooray for the nurses and doctors!
There has been an outpouring of appreciation across the globe and on social media for frontline healthcare workers, but they may not be feeling the love in the workplace as they deal with a shortage of personal protective equipment. And joining me now is the president of the Canadian Federation of Nurses Unions, Linda Silas. Linda, first thing off, the Prime Minister has promised that he will get more equipment. We're hearing stories about how supplies are being rationed now at hospitals. What are you hearing from the nurses on the ground right now?
Everyone is shaking their heads because we hear the message from the Prime Minister and every Premier in every province and territories, but those on the front line are being rationed or the special equipment is being behind locked doors. It's pure craziness, and it's insulting to the healthcare professionals that are there doing their jobs, saving lives, and we need to fix this and fix it quickly.
So it's behind locked doors. Who has the key, and when are they allowed to actually get more equipment?
You know, Michael, in this country, we have occupational health and safety laws that says that any worker must have a safe workplace, just like you, just like any construction workers, firefighters. They must have the equipment to make sure they can do their job safely. So what employers are doing now is not safe, and I would push it further, it's illegal. We have to connect with our employers and say you need to use the professional judgment of your nurse, of your whole team of professional healthcare workers. They need to look at the patient, the situation, and do a risk assessment right there and then and decide what kind of personal protective equipment they need to take care of the patient, but also to keep themselves safe. And this is important to do right now because patients are coming in.
So I wanted to ask you, in terms of the actual pandemic here in Canada, how concerned are you that the big wave of cases has not come here yet and we still aren't ready in terms of equipment or staffing?
Saying that we're not ready is false. We are ready. We have an amazing healthcare system. What is insulting is there's that fear of we might run out of personal protective equipment, of the appropriate respirators, when we know, and what we hear from the Prime Minister down, that they have stockpile. It's almost like the toilet paper fiasco. We have them there. We have to make them available for our healthcare workers. The problem is we're just at the peak, and patients are just coming in. About 6% of patients with COVID-19 enter the hospital, and a third of them enter the intensive care areas. So we have to be ready. But the hospitals, when they look at their system as a whole, they've cleared non-urgent surgeries, the beds are ready, everything. But we're still into this battle of protecting healthcare workers today.
Now, in Italy, they've been having to choose who to treat, who to let die. How worried are you that that could happen here?
You know, we're trained, we're educated to take care of people and do everything we can to save their lives. And when we listen to what's happening in Italy or Spain, it is frightening. None of us in my generations and a few generations before has never lived that in healthcare. So my heart goes to every healthcare worker, every professional out there that's going to have to make those decisions. But honestly, we are doing the right thing in Canada. If we could just continue on our social distancing, people realizing that stay home, give us a chance to get this virus out of our community and give us a fighting chance in our healthcare system to do our jobs. And that's the only thing we're asking. Let us do our jobs to save as many lives as we can, and then we'll be writing a positive history chapter for our country in the years to come.
When you talk about that positivity, earlier in the show, we showed some social media posts, people applauding healthcare workers, but we're hearing that that's not really the way they're treated when they actually return home. What are you hearing from nurses about that?
Yeah, with this virus, I'm not hearing it as much, but when SARS was in Toronto, it was shameful. If anybody knew you were a nurse, you were a healthcare worker, they were escaping you. We are well-trained professionals. We know how to disinfect ourselves, if I can use that plain term, before we enter our communities. We have families too. There's not a nurse, a doctor, a healthcare worker that doesn't have a family that cares about them like you care about your family. So we know how to do it. You need to trust us. But employers need to give us the tools to be able to do it.
Yeah, unfortunately, hopefully that situation gets better, Linda. That's where we're going to have to leave it, unfortunately. Thanks so much for joining us today.
No, I thank you.
Well, that's all the time we have for today. Thanks so much for joining us. For the West Block, I'm Mike LeCouture.